Hey everyone, I'm your host Adrian. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Welcome everyone to today's Rupa Live class presented by Rupa University, the best way to learn about specialty lab works from industry experts. My name is Adrian Martinez and I will be your host for this afternoon. Today, we have a very special guest in Dr. Julia Malkowski with Doctor's Data here to talk to us about mastering gut microbiome testing, a major weapon against chronic illnesses. Before jumping in, a couple of quick housekeeping items. Everyone joining will be muted by default, but don't fret. If you do have any questions, please use that Q&A button down in the menu bar and we will host a live Q&A session at the end of the presentation. Immediately following the Q&A, yours truly will show you exactly how to order this test right on Rupa Health. And if you have to jump early, no worries at all. We are recording this session and you'll be able to find it on Rupa University within the coming days, as well as we will distribute it via email. I know that a few of the distribution emails have been going to spam over the last few weeks, so we're making an adjustment. This will go directly to your email, hopefully this next time. And finally, if you are a fan of this type of content, be sure to check out rupauniversity.com to get access to all the previous sessions that we have done. With that, let's go ahead and jump in. I'd like to introduce Dr. Julia Malkowski. Dr. Malkowski enjoys empowering individuals via docere to teach, to delight, and to move. Upon experiencing the excellent results of restoring the health of her infant son, Dr. Malkowski began her career in naturopathic medicine. She holds both a doctorate in naturopathic medicine as well as chiropractic medicine. Dr. Malkowski has presented at Autism One, International College of Integrative Medicine, the Institute of Women's Health and Integrative Medicine, and the American Academy of Anti-Aging Medicine. She has been published in the American College for the Advancement in Medicine and the Townsend Letter, and remains committed to optimal health on a personal and professional level as scientific support specialist at Doctor's Data, Inc. Thank you so much for joining us today, Dr. Malkowski. I will go ahead and let you take it from here.
Thank you so much, Adrian. I appreciate that introduction. And thank you to everyone as well for your participation today. I know your time is valuable and your schedules are very busy, so I appreciate your attendance today. So let's begin. Today, our discussion is going to be chronic disease and the gut microbiome, a foundation for prevention. And I am Dr. Julia Malkowski, naturopathic and chiropractic physician. Full disclosure, as Adrian did mention, I am a clinical consultant in the Department of Scientific Support at Doctor's Data. All right, so to begin, we're going to talk about actually the national healthcare expenditure. So national healthcare spending is about $4 trillion. And I want to ask you today, what percentage of national healthcare is spent on chronic disease and mental health? With regards to functional medicine, we are seeing our patients one-on-one in the individualized components, yet there is a national public health consideration here to these diagnoses and the treatments that we are rendering with our patients. So what percentage do you think of that $4 trillion is spent on chronic disease and mental health? Is it 20%, 50%, 75%, or 90%? If you could put some in the chat, I could see. So 50, 90, 75, 20, good, all good guesses. So let's take a minute here and see what the answer is. 90%. So of that $4 trillion, 90% of that is spent on chronic disease and mental health. And actually those two are lumped together. So we can see how what we're going to learn today is going to really potentially benefit our patients on an individual level, but actually on a national level as well. And that really highlights our role as functional providers, really in restoring health individually, but to communities and systems as a whole. So we can really do some positive good here with the information that we're going to learn today. All right, so today we're going to talk about chronic illness and what exactly are the most common chronic illnesses. And I'm sure you see these in your practice, in your patients, and also in your friends and family. So the most chronic prevalent illnesses in the United States are going to be cardiovascular disease, cancer, type 2 diabetes mellitus, which of course we know this used to be called adult onset, but because of the pediatric incidence, this is now called type 2. Obesity, which is a consideration now globally as well. Arthritis is one of the most prevalent chronic illnesses, along with Alzheimer's disease, which is a disease that is very, very significant. And if we could help our patients to prevent that, we will. And then depression. I was surprised in my research to learn that depression is considered one of the most common chronic illnesses, because sometimes with these mental health conditions, we don't think of them on par with cardiovascular disease and obesity and diabetes, but they are. So we want to think of these chronic illnesses, and we want to talk about the pathogenesis of these and potentially what we could do to prevent these foundationally for our patients. So let's begin looking at some of the research. Well, we're going to start with the gut microbiome as the foundation. Now, the foundational piece for the gut microbiome, we're going to take it all the way back to the beginning of medicine with Hippocrates, the father of medicine, and he has stated all disease begins in the gut. Isn't that interesting that back at the beginning of our understanding of medicine, we have this foundational piece of diseases beginning in the gut, and we have that connection there. Well, now we are very fortunate in that we have tools and advanced understandings that we can really begin to elucidate these connections between the gut and systemic health. Okay, so what we have here is the gut. When we're talking about the gut microbiome, we want to understand some foundational pieces. We have the bacteria within the colon, we have viruses, we have prokaryotes and eukaryotes. Right now, we're really focusing on the bacteria within the colon and their microbial metabolites. We know that the colon is an important system within the human physiology, and really the microbial metabolites, the short chain fatty acids, especially butyrates, these are the chemical messengers that link the bacteria in our colon to our systemic physiology. So it's a chain of events, really starting with the food that we eat that will actually feed the bacteria. That's going to be the substrates for their energy. They're going to ferment that and create short chain fatty acids as a byproduct. And then those short chain fatty acids will go on to stimulate enteric neurons and things of that nature, which connect to vagus or connect to hepatocirculation. And then this is where you have the end effects of hormones, neurotransmitters, blood pressure, etc. So it's a chain of events starting with the colon, and those gut microbial metabolites are really the chemical messengers. So what really constitutes the microbiome? The most basic consideration within the microbiome is a concept called microbiome abundance and diversity. Now, abundance and diversity are ecological terms that we've borrowed, but they do make sense when we're talking about the colon, the microbiome, because there's so many bacteria within there. The concept is equivalent to what we think about with forestry. I'm sure we're all familiar with the concept that the rainforest is this lush, diverse place. It is very healthy. Unfortunately, with agricultural practices that go in and take down trees, that decreases diversity, and that ecosystem is no longer healthy and vibrant and rich and diverse. It's the same concept within our human colon. So diversity is a wide variety of bacteria within the human colon that's associated with so many beneficial health outcomes. And once we have decreasing diversity of the human colon ecosystem, that we have decreasing health outcomes. So this is a very important matrix here. And then the other consideration is abundance, and that's the value of bacteria within the colon. So the more bacteria within the colon, essentially the better. But we don't want to oversimplify that, because balance is key. As we're going to see, there's some bacteria that we want a lot of, and there's some bacteria that we want a little of. So understanding the balance of the bacteria is very important, and understanding that these bacteria do work together, they communicate together. So we want to provide the best environment for these bacteria within our colon. Today, we're going to talk about some keystone bacteria. I think back to a few decades ago, and nobody would understand if we were started talking about lactobacillus. Now everybody knows lactobacillus, and people are just grabbing it off the shelves for health benefits, right? So now we have other bacteria that we're learning about that are becoming household names, such as Akkermansia muciniphila. I'm sure you've heard that very recently. That these are these keystone bacteria, like Akkermansia fecal bacterium, lactobacillus, bifido. So we're going to talk about those today. And what we see here is going to be the bacteria represented by phyla. Another thing that I'm sure you're familiar with is that bacteroidetes, Firmicutes ratio that has been associated with obesity. Well, we're going to see later that it's actually not that simple. So organizing bacteria by phyla is a broad understanding of it. And we can talk about phyla, we could talk about specific bacteria. This is what's really making up the microbiome. And one last point here is with regards to functional medicine, I think it's important that we understand this term holobiont. Holo means all and biont means life. And the concept is that when we're talking about host physiology and systemic health outcomes, we're going to think about the bacteria within the colon and how that unique makeup influences our unique host physiology together, and our genes and how everything interacts together to create health outcomes. So with regards to the gut microbiome and holobiont and health outcomes, these terms can all be used together to understand the implications of all disease begins in the gut. So let's talk about cardiovascular disease and the gut microbiome. Most people are aware that coronary artery disease is very common. It's the most common type of heart disease, killing almost 400,000 people each year. So during this talk that we're going to spend this hour together, there will be 92 heart attacks during this time, just based on the frequency of heart attacks. So that is important. This is a very common consideration and something that we can employ to help our patients. Over 18 million adults worldwide have coronary artery disease, and this is the leading cause of death. Now, we know that lifestyle disease has a nutritional component. We know this. This is nothing new. Our patients know this. I would say the Mediterranean diet is probably one of the most researched and implicated consideration here with regards to cardiovascular disease. So the consideration is there. We want to make a link. So when we're talking about lifestyle and we're talking about diet, how does that exactly influence health outcomes? Well, the gut microbiome is a foundational link there. So again, the food that we eat feeds the bacteria within our colon. They ferment that to short chain fatty acids, and that goes on to signal systemic physiology. And so the gut microbiome is really the link there. And we know that microbiome dysbiosis has been associated with the progression and pathogenesis of cardiovascular disease, atherosclerosis, hypertension, and heart failure. So microbiome dysbiosis is actually a foundational link between cardiovascular disease and the microbiome. An alteration in diversity in the composition of the gut microbiome is associated with this. Now, the exact mechanisms are unknown, but we have a few different theories, and we're going to discuss that. One of the considerations is that there is evidence that with advanced age, you have decreased vascular dilation. So that ability for the vasculature to compensate is decreased. And that is due to aging. Now, both aging and reduced vascular dilation are associated with the gut microbiome. And again, some of those foundational pieces like diversity and dysbiosis could be considered here. The next consideration is TMAO. So how many people are familiar with TMAO? I'm sure you are. We're hearing more about this. Trimethylene and oxide. Thank you for raising your hand. So now, this is actually a link. So TMAO is potentially the link between the ideology that heart disease is associated with meat intake, and that to remediate that, we should do a plant-based diet health outcomes. So I'm sure we're familiar with this concept. And although this is a controversial concept, I'm going to elucidate this understanding here. So when we consume L-carnitine and from meats and eggs, that actually, when the bacteria have that substrates, they produce TMA, which is then transferred to the liver to produce TMAO. TMAO actually is associated with foam cells, atherosclerosis. It's associated with vascular endothelial adhesion capacities. So in the presence of TMAO, then that we have cardiovascular considerations and adverse vascular outcomes. So that is the potential mechanism of action there. And we can see that it does have a gut microbiome approach. Other considerations here are going to be bile acids and short chain fatty acids that all play a role with regards to host homeostasis. So now with this TMAO consideration, one of the findings that we did find is that when patients take antibiotics, they actually have less TMAO. Now, we're not advocating for antibiotics to decrease this pathophysiology, but we are elucidating that there is this strong microbiome connection here. Now, I don't want everybody to say, okay, now that we have this finding, we need to strictly adhere to a plant-based diet. That's actually not, it's not that direct. One of the considerations is that this TMAO effect does occur in individuals that have additional comorbidities. So individuals that have diabetes, metabolic syndrome, then we have this consideration. And then in individuals that are absent that, we do have we don't have the same health outcomes. But nonetheless, this is something to pay attention to. And we can see the physiological effects of this microbiome consideration with regards to abdominal aortic aneurysm. Stroke is very, one of the ones, chronic kidney disease as well. And then short chain fatty acids play a role as well. So short chain fatty acids are going to be derived from the bacteria that then the food that we feed them. Essentially, soluble fiber is a great idea here. So we feed the bacteria soluble fiber, and then they ferment that to create short chain fatty acids, and that could potentially remediate this process. So this is a strong connection for the gut microbiota and cardiovascular disease. One thing I would mention here is right now we're living in a time where there's a lot of advocacy for a carnivore type diet. That's a whole other talk that we could get into. But I would say that in patients that are utilizing the carnivore diet, I would take a look at their gut microbiome and get a look under there and see what's happening with regards to butyrate with diversity and with dysbiosis. I have seen quite a few individuals on the carnivore diet suffer from dysbiosis. So we want to be evaluating this in our patients. Okay, the next chronic condition we're going to discuss is cancer. So unfortunately, cancer is prevalent. I'm sure you see it in your clinic with your family and friends as well. And really, the American Cancer Fund recommends prevention strategies, early detection, and cancer screening. So we're still at this ideology that really one of the best considerations is going to be prevention. We do know there's a strong link between the microbiome and cancer via the immune system. The immune system we know is intricately linked to activating, the microbiome is intricately linked to activating, training, and modulating the immune host response. A lot of that is actually developed in infancy and in childhood, where we do see a microbiome link. And some of that can even go back to methodology of birth, that inoculation of the first microbiome via vaginal birth or the hospital-acquired birth via C-section. That plays a role in Th1 and Th2. So we do know that the immune system and microbiome are intricately linked. And so there is some evidence now that we can utilize the microbiome to help a patient better respond to numerous forms of cancer therapy. So there's another role to use the microbiome to support that. Now, I'm going to caution at this moment with this direct targeted approach because there's more research needed in this area. And this is just basically an understanding that there is a strong link between the microbiome and the immune system. And that is really one of the best connections between cancer and the gut microbiome. Our next consideration is going to be diabetes. So according to the CDC, 34.2 million Americans have diabetes. I'm sure you see this in your practice, and more than double that have pre-diabetes. So pre-diabetes is really where we want to intervene, right? So this is over 60 million Americans right now have pre-diabetes. So let's get in there and let's help these patients. There's a strong link here. So we know that this is associated with diet and lifestyle and weights and all of these things. There is a foundational approach in the microbiome. So one thing, we wouldn't actually think that type 1 diabetes, we think of that a little bit differently. We don't think it's associated with diets, but there is some evidence that type 1 diabetes increased in the United States after World War II, and this coincided with the introduction of processed food. So there is a theory that is potentially related to dietary considerations. Additionally, we want to talk about metabolic syndrome with our patients. I mean, there is definitely some evidence that short chain fatty acids and soluble fiber, can help to remediate these conditions. Now, with specifically diabetes and bacteria, it's going to be when these bacteria are decreased, we see increased incidence of diabetes. So the bifidobacterium, the Bacteroidetes, the fecal bacterium, the Akkermansia, and the Roseburia. The other bacteria that we see increase with diabetes are going to be Ruminococcus, Fusobacterium, and Blutula. So this would be important to monitor this in your patients. And at the end of the day, I'm going to say again, this is another indication for monitoring diversity and dysbiosis, because diabetes is associated with dysbiosis and associated with decreased diversity. And both dysbiosis and diversity are also associated with glucose tolerance and glucose metabolism. So you can consider this alongside your traditional approach to diabetes. And also, I would say for those pre-diabetics as well. So some good evidence here. The next consideration we're going to talk about is obesity and the gut microbiome. We know in the United States, obesity is very prevalent, and we're seeing globally increased incidence as well. So according to Harvard Chan School of Public Health, prevention strategies for obesity are important, and we know these, and our patients know them, right? So physical activity, diet, screen time, sleep, and stress. Can anybody think of a tie between all of these factors and our lifestyle in the past few years? Stress, sleep, screen time, diet, and physical activity. Well, I would say, talking to my patients, that all of these have just gone off the rails since post-pandemic. I'm sure you see that as well. So these contributing factors and these lifestyle factors are very significant components for our patients at this time. With regards to obesity, we want to talk about systemic inflammatory changes. And we know that. We hear inflammation over and over and over again. Now, with regards to that, diet plays a role, of course. And the diet that's good for the microbiome is also a diet that's good for inflammation. So that's going to be, we'll speak of it again, but it's going to be increasing soluble fiber. It's also going to be considerations for these like anti-inflammatories, olive oil, cod liver oil, garlic, things like that. So, olive oil is excellent for the microbiome. And there's also a theory that with regards to the Mediterranean diet that we spoke of briefly, that the olive oil is actually the smoking gun in the Mediterranean diet, that because that diet is so rich in olive oil, the anti-inflammatory effects of it are actually what is responsible for the health outcomes of that diet. So, that's just a side note. I know there's a lot of considerations with regards to quality of olive oil and things like that, but it just shows that inflammatory considerations are just so important for health outcomes. Okay, so yes, the gut microbiome is important with regards to obesity. And we also want to talk about absorption of our nutrients, because I know that I'm sure you've seen this so often in your patients, that mineral deficiency is a consideration as well. So, people that are eating the standard American diet are not only consuming excess fats and carbohydrates, but they're also going to be minerally deficient. So we want to think about those, two sides of the coin. Now, I mentioned briefly, and I'm sure you're familiar with this, Firmicutes, Bacteroides consideration. Recently, it was one of the theories that a decrease in Bacteroides with an increase in Firmicutes is responsible for obesity. Now, we see this quite often in science, right? As more and more studies come out, we have contradictory information. So where do we land? I wouldn't quite hang my hat on this. There are other findings that I would consider. So let's take a look at those. Now, with regards to obesity and the microbiome, something I would consider is the species level. So these bacteria have been associated strongly with obesity, and that's going to be the Clostridium, the Eubacterium, the Cantibacterium, 2 lactobacillus species, and the Actinobacteria species. So you can take a note of these bacteria and make sure they are at optimal levels. Now, again, I'm going to bring it back to this microbiome abundance and diversity. So increased abundance is associated with a healthy weight, and lack of diversity is associated with obesity. So it's very important to take a look at these foundational components. Now, please consider this. In your patient, their gut microbiome could strongly be influencing their food preferences, right? And we're not just talking about the presence of yeast indicating sugar cravings. We're talking about if the patient has inflammatory proteobacteria, Escherichia species, you know, the microbiome is, that microbiome is not going to be suitable to a healthy diet. That microbiome is going to be suitable to the standard American processed food, excess fat diet. And what's going to happen is, unfortunately, in those patients, you're going to tell them, okay, you need to change your diet, you need to eat healthy, but the microbiome is not craving that, right? And there is this gut-brain connection. I mean, we know that. We know in patients that eat caseomorphins and gluteomorphins, gluten and dairy, that does have an opioid-like effect on the brain. And we see this in our patients. So we need to consider that the little gut bug in our patient might actually be making decisions for their food. For their food choices. So it's important to also consider that. And it's also important to consider that when patients make changes, there might be some GI disturbances, just because if those healthy bacteria aren't there to digest the soluble fiber and the fiber, it'll take a little bit incremental time to have a transition period. So that's really important to test your patient's microbiome and see where they're at, and that can help along the way. So I'm sure one of the things you're familiar with now is fecal microbial transplant. I mean, I see this everywhere now. It seems like such a novelty. We do know that in patients that have had fecal microbial transplant for other conditions, if that donor was obese, that patient that received the transplant, the recipient, actually ends up with obesity as well. So there is a strong connection there. Now we're doing a lot better screening for these donors, so we no longer have these issues, but that was a consideration previously. Okay, now enter a new novel treatment. Has anyone heard of this? Fecal microbial transplant collected early in your life. So in your young 20s, when you're just, the picture of perfect health, and then you keep that, and later in life, in your 40s and your 50s and your 60s, 70s, 80s and beyond, you could actually transplant from your own donor sample. So this is a new idea. To my knowledge, it hasn't been utilized yet, but that would be interesting to see this therapeutic. And then another thing with regards to the gut microbiome, again, diversity is so important. Decreased diversity in obesity, even in twins. So in twin studies with the same genomic makeup, we have individuals, and the twin that has a healthy body weight has healthy diversity, and the twin that has obesity has decreased gut microbial diversity. So this is so important, along with dysbiosis. And now we're going to talk about everyone's favorite topic, glucagon-like receptor, GLP-1 receptor agonist. So I'm sure you have many, many patients that are on these injectable weight loss drugs, such as Ozempic and semaglutide, Wegovy, etc. So this is actually a gut peptide approach. GLP-1 is made in the gut. When we eat food, the intestines are stimulated, and you feel full, and that stimulates GLP-1. It tells your body you're full. It tells your body to metabolize insulin and glucose. And so that's actually what the GLP-1 lasts. I believe it's about 2 minutes endogenously produced GLP-1 lasts 2 minutes, and then the pharmaceutical version lasts 1 week. So that's the difference here. Now, if you want to stimulate GLP-1 in your patients outside of the pharmaceutical drug, you could think about these considerations. Akkermansia eosinophila, bifidobacterium, and polyphenols, those have been shown to stimulate GLP-1 as long with short chain fatty acids. So we're going to consider soluble fiber to support short chain fatty acids, and then GABA. So those all play a role in GLP-1 activity. So we can help our patients in that regard, and also ameliorate some of the GI effects that come from the medication by doing this gut approach. Okay. The next consideration is going to be arthritis. Rheumatoid arthritis does display a reduction in certain bacteria, those in the Bifido and the Bacteroidetes family, and then increase in the Prevotella family. So that's a consideration. We have seen in animal models that are germ-free that they do not develop arthritis. So when we talk about animal models, germ-free animal models are a clue that there's a gut connection. Sometimes it doesn't tell us exactly what it is, but it tells us there is that connection. And then some of the considerations here are going to be short chain fatty acids, inflammation, diet. Now, intestinal permeability is a consideration here, and autoimmunity as well. And then some drugs that were used to treat rheumatoid arthritis actually have antimicrobial effects. So then patients who are taking these drugs for RA have absolutely improved GI health outcomes. So we know there's a strong connection there. Decreased microbial diversity is going to be a consideration as well. And the fecal bacterium has been shown to be decreased in these individuals. And then dysbiosis. I did read one study that they were monitoring to see that they did show that dysbiosis precedes development of RA. So in patients that have RA or patients that have dysbiosis, you know, there's a connection here. So our next consideration is going to be Alzheimer's disease. Alzheimer's disease is amongst the most common deaths in the US. This is a terribly sad condition for individuals and their family members, really. There's no established way to prevent this. Previously, we were talking about that amyloid plaque hypothesis. Now research has shown that individuals have amyloid plaques, but that is not going to be the cause of Alzheimer's. There is some evidence that the increase in the insoluble amyloid plaques is actually not the issue. It's the decrease in the soluble plaques. Nonetheless, the plaque formation is actually associated with the gut microbiome, so there is that connection there. We do see a link here with individuals with Alzheimer's and depression. So I also want to remind you that patients that are diagnosed with Alzheimer's or depression, you know, that is going to change actually the way they eat. They might not remember to eat, you know, those types of things, which is going to be a confounding factor. Okay, so with the pathogenesis here, it's gut microbial abundance and diversity. That does influence neurotransmitters and neuromodulators such as serotonin, kynurenine, catecholamines, and those amyloids as well. So there is some evidence and some researchers that believe that Alzheimer's disease does begin in the gut and is related to imbalanced gut microbiota. And again, there's a vascular pathophysiology consideration here because there's a vascular component based on MRI imaging of these individuals. And remember, we talked about the gut connection with vasculature health with regards to cardiovascular disease. So again, we have that tie-in there. There is a consideration here with individuals with ApoE that increased bacteroides and decreased bifidobacterium is exacerbating that. So those intermingle and again, decreased diversity. Okay. And depression. Okay. So switching gears to a mental health consideration that is under the umbrella of chronic disease. Okay. We know that this is very prevalent. Before the pandemic, it was about 17 million adults had at least one major depressive episode. After the pandemic, I'm sure you've seen those numbers skyrocket in your clinic. Of course, we know there's this gut-brain axis. The vagus nerve is there. So serotonin, we know that 90% of serotonin is synthesized in the gut. What the connection here is that when we create serotonin in our gut, those microbial mediators go on to stimulate the vagus nerve, and then the vagus nerve sends the signals up to the brain to create neuronal serotonin. So that serotonin in the gut stays in the gut, but it signals neuronal serotonin stimulation. Okay, and so that's the link there. There is a strong link between the microbiome and mental health. I mean, probably most people don't know that the microbiome is associated with disordered eating like anorexia, schizophrenia. It's also associated with extroversion, so personality even. So it's not too far-fetched to think, microbiome and mental health are linked. In depressed individuals, we see increase in Faecalibacterium and we see decrease in Faecalibacterium protenitzii. Of course, we see decreased diversity again. So it's really important to take a look at the gut microbiome in individuals and help them. So with regards to the gut microbiome, what are really the key considerations here? Well, of course, diet, because like we said, what we eat feeds the bacteria in our colon. Specific nutrients are very healthy, those minerals, again, zinc, magnesium, things like that. We want to assess and address. We don't want to guess, we need to test. We can see that there's so many foundational pieces with regards to the microbiome and our patients' health outcomes. So we could take a look at that and help them. Microbiome abundance and diversity is so important. Today, if you went on, if you looked into peer-reviewed literature and you could pick almost any health outcome in microbiome diversity, and there's a link. I think last I checked, there was about 13,000 research articles about microbiome diversity, and there's more and more published every single year. So this foundational piece is so integral to health outcomes. Now, intestinal permeability is also a consideration with regards to microbiome health. I mean, some people don't understand that intestinal permeability is a very dynamic system. It is not static. So those gap junctions are constantly opening and closing, and there's things we can do to influence that. And then, of course, we want to talk about pathogenic bacteria, parasites, and yeast. And then one thing that people don't think about too often is the parasympathetic nervous system and microbiome health. So this enters the concept of eating hygiene. I'm sure everyone is familiar with food hygiene, right? We can't mix raw meat with vegetables and things of that nature because food hygiene, but eating hygiene. And this is a really important concept because if you are going to be sitting down and chewing your food, smelling your food, you're going to be stimulating digestive enzymes. And people in the United States that are just going through drive-throughs, we are not smelling the food. We don't have the enzymes there to digest the food. We're not sitting down to eat the food. So when people are in sympathetic nervous system versus parasympathetic nervous system, you are not in rest and digest, you're in fight and flight. So that makes a really big difference. So those little things are important to consider as well. Okay, so the next thing we're going to talk about is intestinal permeability. And the factors with regards to intestinal permeability are microbiome dysbiosis, and this decreasing mucosal barrier integrity. Now, the consideration here is that the enterocytes do not want any bacteria touching them. And when we have microbiome dysbiosis, and this leads to decreasing mucosal barrier integrity, that gelatinous substance, if there's lack of soluble fiber or dysbiosis, that will be compromised. And then the bacteria themselves will actually touch the colonocytes. That will induce intestinal permeability via irritation. And once we have intestinal permeability, we know this is associated with a variety of conditions, type 1 diabetes, rheumatoid arthritis, obesity, and then glucose intolerance with type 2 diabetes. So those are the chronic conditions here that we want to think about. And then in patients with type 1 diabetes, we see intestinal permeability before the onset of symptoms. And another consideration is that actually stress increases intestinal permeability. So, again, to consider eating hygiene and HPA access and all of that does play a role here. So here we have a zonulin assessment of intestinal permeability for a stressed individual who we're thinking about the development of RA. Zonulin family protein indicates intestinal permeability. You can measure this in serum or in fecal matter. So in serum, it actually correlates to the lactulose mannitol drink test. So this is an easy venipuncture. This patient here has a very high zonulin of 70. So they have intestinal permeability. And then when we do the lactulose mannitol drink test, we see that as well, that the intestinal permeability is there. So this is a patient to remediate this intestinal permeability. So how are we going to do that? Well, the considerations are going to be probiotics. You know, there is some evidence there that probiotics can reduce serum and fecal zonulin levels. Diet is going to be really important. We need to add soluble fiber. You need to avoid alcohol, processed foods, sugar. So like, you know, the typical American diet that is a beer and French fries and a burger, that's exactly what you want to avoid. And you want to address dysbiosis if it's present. The anti-inflammatory therapies are going to be BCQ, so curcumin, vitamin C and curcumin, gamma-linolenic acid, omega-3 fatty acids, and then also aloe vera. So the next consideration, it's really important to think about zinc, beta carotene, pantenothenic acid, and L-glutamine. Those are also important to restore GI mucosa, and of course address stress if that's there. And then the next consideration is going to be, you know, perform testing and evaluate the additional findings. So with regards to the colon and healthy gut assessment, what are we going to look at? Because we know there's this foundational piece with regards to health outcomes. We know there's this significant piece with regards to chronic disease. So balance is very important. Remember, we talked about at the very beginning that microbiome abundance and diversity is akin to a rainforest and ecosystem. So we want to look at these matrices of abundance and diversity. We didn't talk about it too much today, but of course, pathogenic viruses, bacteria, and parasites are always going to play a role. We don't want to do the thing where if we have a hammer, everything is a nail. You know, your patient could have decreased diversity and still have a parasite or a pathogenic virus. We want to look at everything holistically, okay? Again, yeast is a consideration as well. Fecal secretory IgA, that immune marker, is very important to monitor. You know, the immune system in the colon is very important. It's really the first chance where our internal environment meets that external environment. So we want to make sure this is functioning properly. Inflammatory markers like lysozyme, lactoferrin, and calprotectin, those are important as well. And short-chain fatty acids. Remember, short-chain fatty acids are the microbial mediators. The short-chain fatty acids are really that link between the colon and systemic physiology, as they are chemical messengers. Okay, so let's switch gears here to talk about some of these keystone bacteria. Remember, we said previously that a few years ago, nobody knew the name lactobacillus, and now it's a household item. So we're talking about some keystone bacteria that are emerging with regards to systemic physiology that you may be aware of. The first one is Faecalibacterium prausnitzii. This is such an important bacteria because it's closely associated with butyrate production. And we know that butyrate is very anti-inflammatory in the colon, but it also has influences over systemic physiology. So I would say Faecalibacterium prausnitzii is one that it's really important to understand the value of this in your patients. It does play a role in that mucosal barrier integrity that we talked about, that is potentially part of the pathogenesis of intestinal permeability. So it's really important in those patients, in those individuals that you're thinking about autoimmunity. So Faecalibacterium also has a very strong anti-inflammatory effect. So when it's decreased, you'll see these in patients with celiac disease, IBS, IBD, but then for the chronic conditions, we're talking about bipolar disorder, Parkinson's, and major depressive disorder. So this one you see very commonly in individuals with those conditions, that it's decreased, because this is such a key factor. The next one is Akkermansia muciniphila. Probably a few years ago, most people didn't know about this, but I'm sure you are familiar with this one now. Muciniphila, that means mucus loving. So this bacteria is a mucus barrier component. It's shown to be decreased in patients with diabetes and obesity, so very significant consideration, and it increases after weight reduction. So remember we talked about those GLP-1s. Akkermansia does stimulate GLP-1, so here's another role there. It's definitely lower in patients with a low FODMAP diet, so you may be employing a low FODMAP diet for your patients. I would just recommend monitoring their gut microbiome along the way and making adjustments. Low FODMAP diet is potentially necessary for a short period of time, but for an extended period of time, those bacteria really do need the soluble fiber, and that's why it decreases in the low FODMAP diet. One of the food items that people are really employing here is going to be pomegranate. So polyphenols are so important for the colon, and pomegranate is popularly talked about for this bacteria. And of course, it plays a role in intestinal permeability. And then the Faecalibacterium is just another bacterium that we're going to highlight today. This one produces acetate and propionate. So sometimes in the colon, when we see bacteria that are associated with acetate and propionate production too high, we can see adverse health outcomes. So in this case, it's going to be a major depressive disorder. It's actually decreased in patients diagnosed with Alzheimer's. So again, balance is key. And it's really important to consider that we want to feed this bacteria. So cruciferous vegetables are very important here. Cruciferous vegetables are a great food item for many of the bacteria within the colon. Okay, so we talked about the systemic physiology and chronic disease and the components of the microbiome that are linked. And we talked about some key bacteria that are associated with this, but now we're going to talk about testing the microbiome, evaluating it. We are functional medicine providers. We are internal medicine doctors. We are going to look under the hood and see what's there. It's just akin to an orthopedic surgeon taking an x-ray, right? So we talked so much about microbiome abundance and diversity. So we see here that this is the patient's result is that white surface area, and it is superimposed on the normobiotic reference range, which is that green hexagon there. So it's very important to see how your patient compares to the normobiotic reference range. And this is a beautiful diagram that you can easily show your patient. This is your result. It should be on that green hexagon there. So for this result here, we see the patient's microbiome it's reasonable. It's almost making a hexagon. That white surface area looks decent. It doesn't look teeny tiny pulled in. Sometimes you'll see it really pulled in, and that's going to be low abundance, right? The closer it makes to a hexagon shape, the better diversity there is. Sometimes you'll see a square or a rectangle, and that's going to be decreased diversity. So the next thing you'll see on the test, the GI 360 did an excellent job of taking all this information and putting it into these matrices of the dysbiosis index and the diversity score. Because remember, dysbiosis is so important, and so is diversity. It's really the foundational piece for health outcomes. So the way that this portion of the test is organized, it's looking at 45 different bacterial analytes that have been shown to contribute a healthy gut from an unhealthy gut, so dysbiosis from healthy guts. And the conditions studied were IBS, IBD, obesity, diabetes. And what we're able to determine here is a computed algorithm to create a score. So a dysbiosis score, which shows how dysbiotic or how normobiotic your patient's gut is. 1 and 2 are healthy normobiotic guts, and then 3, 4, and 5 are dysbiotic gut. So this patient here is at a 3, that's a moderate score. And then for diversity, the inverse is true. Remember, we're talking about a rich, diverse ecological system, and then healthy scores are going to be 4 and 5. 3 is the moderate score, and then 1 and 2 are the lower scores. Okay, so this is a beautiful information and a beautiful diagram that you can work with your patients. And the first section is organized by phyla, and then we have these scores here representing dysbiosis and diversity. And I said that the dysbiosis and diversity scores are based on 45 different analytes. Here we have a sample page of that that's showing the different analytes that are included. This is just the first page. This is the Firmicutes phylum. It's interesting to note that within this group, there's so many bacteria that we know of, right? So Lactobacillus, which is a household name. We have the Faecalibacterium that we talked about. We have the Ruminococcus, which is an important mucosal barrier bacteria. The Streptococcus, the Veillonella. So all of these bacteria are calculated and represented in that dysbiosis index and the diversity score. And then here is just another way to look at it, because all of these bacteria are very unique, yet they're all within the Firmicutes phylum. And so it does kind of show that the old idea of looking at the ratio of phyla, like Bacteroides to Firmicutes for obesity, didn't quite pan out. And so now we have great information with regards to individual bacterium and then this dysbiosis and diversity score. So like Hippocrates said, all disease begins in the gut, and now we get to take a look and actually see what's happening. So it's quite fascinating. And with our last few minutes here, let's take a look at some cases. So our first case is an individual who has suffered with obesity and depression for the majority of their life. This patient has the fortune of seeing a functional psychiatrist. So this functional psychiatrist decided to do a GI 360, which is great. So we're seeing more and more psychiatrists understand really the connection, and psychologists understand the connection between the gut and mental health. This individual has reported that within the last 3 months, they switched to a less processed food, although they had been on the standard American diet, reported losing 20 pounds, and has also recently been treated with 3 rounds of antibiotics for H. pylori. So here we see their microbiome. The web there is their result superimposed on the normobatic reference range. Just one clinical pearl, I would mention that Actinobacteria phyla is a little bit lower. So in my mind, I'm thinking about vegetable consumption. So maybe a diet diary is going to be a good idea. The dysbiosis index looks moderate at 3, and the diversity score looks moderate at 3 as well. So let's take a look here. All right. So what do we see here? Remember when we talked about depression, this Faecalibacterium prausnitzii is low. So low Faecalibacterium prausnitzii is associated with major depressive disorder. And we see the patient has elevated inflammatory bacteria, proteobacteria, and Escherichia species. So for this individual, it's very it's a dietary consideration here, but we know that this is a foundational piece. So we're going to want to move away from these processed foods and maybe use an anti-inflammatory. We talked about olive oil. You can use turmeric, glutamine, things like that. And I would talk to the patient counsel about vegetables and things like that. But we could see there's a foundational piece there for obesity and depression in this patient's microbiome. Our second case, we're going to switch gears. So you've probably seen this patient in your clinic. This is a young woman, 26 years of age, who has she's dealt with the digestive issues basically her whole life. She's had no diagnosis or no relief, and she's just living with it. She is a smoker, and she's heard from a friend, and she's thinking that she has intestinal permeability because she heard of this leaky gut phenomenon. Okay. Now, for this individual, I just want to mention that smoking does play a role with dysbiosis. It does influence dysbiosis, and there's a connection in the microbiome for weight gain after cessation of smoking that potentially has a gut microbiome component. So when this individual decides to quit smoking, we can monitor the gut microbiome to potentially remediate those effects. Okay. So let's take a look at her gut. Okay, the first thing we have here is this microbiome abundance and diversity, the web. This looks, again, lower in the actinobacteria. So we're thinking about vegetables for this patient, a little bit higher in Bacteroides and Firmicutes. Her dysbiosis index is 3, so that's moderate, and same thing with her diversity score is 3, and that's moderate as well. Now, on GI 360, we have these excellent markers that are the key findings. This is the first column here. And these are, remember how we said GI 360 is based on 45 different analytes? What we have done is we have taken those analytes and put them into functional guilds. Therefore, you don't have to look through every single bacterium line by line. There's 3 pages of bacteria. If you want to do that, you can. And there's also a paragraph for each of those bacteria at the end of the report. But you can also look at the functional guilds and think clinically with respect to those. The other thing is too, this is a great excellent learning tool for your patient to see the functional guilds. So for this patient, she has a moderate dysbiosis, moderate diversity, but then we look at the makeup of her microbiome, we can see her butyrate producing bacteria are low. And we know that butyrate producers are so important with regards to inflammation. So the patient might be at risk for inflammation within the colon, but then also systemic inflammation. Those gut barrier protective bacteria are compromised as well. So gut barrier is a precursor to intestinal permeability. We're thinking along those lines. The intestinal health markers are off as well. The pro-inflammatory bacteria are within range, but then the balance between the gut barrier protective bacteria versus the opportunistic bacteria are off. So we do want to help this patient here. To support those butyrate producers, we're going to add soluble fiber. That's really important. The fiber feeding approach is the best approach. This is a 26-year-old female, so we would do about 10 grams of soluble fiber per day, 10 to 12. To support those gut barrier protective bacteria, the soluble fiber is going to help as well, but we could also do mucosal barrier integrity. There's so many different options, but L-glutamine, marshmallow, things like that. So that's going to be a good place to start. Now, for somebody that's had lifelong health issues, we notice there is a C. difficile toxin A and B. This is a PCR test, so this may or may not equate to an active infection. So this could be a component of the patient's consideration, or this could be a resolved infection. But take a look here at carbohydrates, low secretory IgA, and high beta glucuronidase. So let's take a look at that. And then here's her, here's her bacteria. Like we said, lower butyrate. Fecal bacterium praenicii is lower, so the patient has lower butyrate. Eubacterium hali is lower, so these bacteria are low. Therefore, butyrate is low. Therefore, the patient is at risk of inflammation. So we're going to support that along with mucosal barrier integrity. And then we're going to talk about the pathogens panel here real briefly mentioned. This is PCR. So everyone is familiar now with PCR because of COVID. Just the concept is similar, that this is a very sensitive and specific test. If your patient is symptomatic, then you can go ahead and treat. If they're not symptomatic, they can be an asymptomatic carrier, or this can be a resolved infection. With C. difficile, actually up to 20% of the population can be an asymptomatic carrier. So for this patient with a lifelong history of digestive issues, this is not an acute consideration. So, but it is interesting to note that at one point she did have this. For her, we do see with those low butyrate producers that tends to cause GI complaints. And then also with these elevated carbohydrates, that is an indication of intestinal permeability. And the fact that the patient has those lower mucosal barrier integrity bacteria, that is a precursor to intestinal permeability. So this is a patient to do a serum zonulin on. Her secretory IgA is low, so we want to think about her vitamin A and vitamin D status. This is going to predispose her to an infectious agent. So we do want to support that. And then her beta glucuronidase is too high. Beta glucuronidase is going to cleave glucuronidation of toxins and hormones that have been conjugated for excretion. Beta glucuronidase is going to cleave that, and then the toxins and the hormones are going to be available for recirculation into the systemic circulation again. So this would be a patient too, I think about estrogen status and things like that, especially in women with GI issues. There is a strong GI estrogen component and the microbiome, estrogen, and GI disturbances. I mean, those really go along together in women. So you could help this patient very easily. And then our third case is, we're going to switch gears just slightly here. This is a patient, 50-year-old female, and her complaint is fatigue and weight gain and obesity. So this is a chronic condition. The patient does have hypothyroidism, but we wanted to take a look at her HUMAP. So this is a urinary test for metabolites, hormone metabolite testing. The patient does have elevated cortisol and estrione, and this is just showing us that there is a strong connection here with the gut microbiome and the HPA axis and hormone metabolism. So we saw with the beta glucuronidase, and now we're seeing it here with patients that have the chronic conditions. And right now with so many patients, stress is very important, and stress does play a role with regards to the gut microbiome and is associated with dysbiosis. So patients that display visceral adiposity and obesity, we can think about hormones, but we can also think about the gut together. Okay, and just some takeaways here today for GI health. Remember, we talked about fiber so much, that's very important. I'm sure you know fermented foods are very important. You can combine those together. We briefly spoke about polyphenols and pomegranate. That is very important, and these things can all work together to really feed the microbiome. Of course, water is important, and mineral-rich foods. We talked about olive oil and anti-inflammatory fish oil. So take-home thoughts today. Lifestyle does contribute to chronic disease, and the microbiome is really that link between lifestyle and chronic disease outcomes. Microbiome abundance and diversity does influence chronic health outcomes. We want to test the gut microbiome and address these findings accordingly, and I really urge you to consider utilization of the gut microbiome with regard to the foundations for health. So thank you so much for your time and attention today. Any questions?
Only about 1 million questions, Dr. Malkowski. Thank you so much for hopping in and doing this fantastic presentation. Before jumping into Q&A, thank you everybody for joining. I know we are at the hour mark, so if you have to jump, no worries. We of course record this and we'll distribute it within the coming days, along with the Q&A that we are hopping into. So if you can stick around, we're going to go through Q&A, and then I'm going to jump into a quick presentation of Rupa Health and show you exactly how to order all the tests from Dr. Zeta. So with that, let's jump right in. So the first question that we got would be, could akkermansia help with obesity?
Yeah, there's definitely some evidence for that. Absolutely. Yeah. And we know that it's decreased in individuals with obesity. So supporting that is a great idea. Yes.
Yeah. How do we know who needs butyrate?
Everybody needs soluble fiber to support butyrate production. So you can frankly measure butyrates in the colon, and really the best thing to do to support butyrate is soluble fiber. And butyrate is very anti-inflammatory, so it's a very important component of the whole system. So everyone needs it. Yeah.
In your experience, how do you deal with dysbiosis? Testing bacteria and heavy metals?
Yeah. So so to evaluate dysbiosis, I would look at that dysbiosis index on the GI 360, because again, that score is validated. Those scores were developed over 5 years. There's 11 peer-reviewed journal articles on those, and you can look at gi360.com to get that background info. So that dysbiosis index is very helpful to evaluate. And then I would look at the individual components with functional guilds. So if there's butyrate producers, if there's inflammatory bacteria, and intervene at those levels.
Perfect. When you talk about naturally stimulating GIP-1, how do they do that in layman's terms?
Yeah, so to naturally stimulate it is going to be the soluble fiber supporting the akkermansia, and then GABA production. So you can definitely stimulate it naturally. The consideration is the half-life, though, is pretty short for endogenously produced GLP-1. It's about 2 minutes versus the pharmaceutical drug is 1 week. So you'd want to just make sure your patient has the healthy foundational microbiome, really.
Amazing. And I see a ton of questions coming in the chat. If you could please just drop those questions in the Q&A. That way it'll allow me to track things a little cleaner. I'd appreciate that. What are some sources of GLA, and are there any companies that you would recommend?
Gamma-linolenic acid, I'm not sure. I believe it's going to be like sunflowers and things like that, but I don't know of a specific company.
I love sunflower seeds, so maybe that's a source.
Yeah.
This is my favorite company of sunflower seeds, in case you're curious. How often should you monitor the gut microbiome? I like this question.
Yeah, that is a good question. So I would say it takes 2 weeks to make the gut can change in as little as 24 hours, depending on what we're eating, right? And we see that especially with intestinal permeability. So if your patient went out for a celebratory beer and burgers the night before, that fecal zonulin is going to be changed. Serum zonulin will stay the whole time, consistently. But so the microbiome can adapt pretty quickly, about 24 hours. But I would say it takes 2 weeks to make the consistent microbiome, like your everyday microbiome. And so how often should you test? I mean, it depends what you're doing in your clinic. I think it does make sense to do a yearly or every 6 month screen. And then if there's something you want to intervene, go ahead and do your intervention, and then just give it a 2-week period to do the your natural everyday diet and then test.
Great. Not sure if you know the answer specifically to this one, but is it, I guess, the location that's high in polyphenols, is it the pomegranate seeds or the skin, or both?
I believe it's the skin, but I'm not an expert in that.
Yeah, it's a good question. What are some preparatory steps that patients need to keep in mind when they're sending in their stool samples to increase the accuracy of these tests?
Yeah, excellent question. So I would say that, consume your everyday diet. Don't do it after you've been on a 2-week-long vacation. Avoid antibiotics for 2 weeks, avoid probiotics for 2 weeks. Those are the things to do.
Yeah. Would it be ideal for patients to break biofilms or other things that may be around organisms to ensure that that they take the samples before sending in?
That's going to be a case-by-case consideration. We don't have any evidence that's necessary. But if your practitioner employs that, then you can all means go ahead. But we don't have any evidence that would be strictly necessary. Like the technology is very advanced. Those PCR tests are so sensitive and specific. They can pick up RNA and DNA of things that have been there for months in the past. And so, yeah,
Makes a ton of sense. Do you recommend gut microbiome testing for pediatrics with IBS specifically?
Pediatrics with IBS?
Yeah.
Yeah. So the GI 360 testing is available, and it's applicable for any age, right? I mean, unfortunately, I'm sure you're seeing this in your practices, that these conditions are happening at younger and younger ages. I mean, I've seen infants on PPIs. Yes, you can use it at any age. The one thing you can use it at any age, and I would definitely take a look at the lysozyme, the lactoferrin, and the calprotectin, and the dysbiosis index. Yes.
When it comes to the GI 360, as I'm sure we all know, there's a few other GI options on the market. I guess what specifically with the GI 360 do you find to be basically setting it apart and the most beneficial?
Yeah, there's a few different considerations. Like I said, we know for so long, since the beginning of medicine, that there's a gut connection here. And the cool thing about GI 360 is that the way that it was designed is they took patients that had conditions such as IBS, IBD, obesity, diabetes, and they looked at their microbiome and the bacterial makeup and compared that to normal biotic controls. And so the GI 360 is based on that profile, and that's the dysbiosis profile. So that is unique to our test. You can right now use technology to understand a bunch of bacteria within the human colon, but at the end of the day, what is the clinical implication of that bacteria, right? And we know that dysbiosis is a foundational piece, and we also know that diversity is a foundational piece to health outcomes. And so GI 360 provides that information. And then in addition to, the fact that our probes are FDA approved or EU marked, and we're also doing the ova and parasitology by microscopy, that 3-day sample, that's still standard of care, and that's fairly unique to our test. And the culture and sensitivities too. So for dysbiotic bacteria and yeast, we'll provide direct culture and sensitivity performed in the laboratory.
And then once a practitioner orders the tests, what resources are available to assist with the interpretation component of it?
Yeah, absolutely. So with your doctor's data account, we are available to you scientific support. So we can go through the reports with you via the phone or Zoom. And, that's really where practitioners kind of, put the pedal to the metal. And you can really elucidate a lot and learn a lot from that. So,
yeah. And I think it almost even ties into the previous question as to like what sets the GI 360 apart beyond just the testing components of it. Speaking personally, the doctor's data team is incredible. And so like working, having access to a fantastic test is one thing, but having the ability to work with a company that has a team that is equally as incredible, it's a win-win all around. So that's just a little shout out to y'all. How do you stimulate akkermansia?
Yeah, so polyphenols are going to be one of the things, soluble fiber, pomegranates, things like that. Yep.
Perfect. And then almost tying into that, what's the best soluble fiber?
Yeah, so I think it's really important to be at the range of 8 to 15 grams of soluble fiber per day. There's like a gender component of there, an age component within that supplement range. Now, people get confused sometimes about soluble fiber. So they'll say, my patient is eating a lot of vegetables, but soluble fiber is going to be, the vegetables are going to be 2/3 insoluble to 1/3 soluble fiber. So you really want to make sure you're getting that soluble piece. It's going to be red kidney beans, lima beans, chickpeas, Jerusalem artichokes. Supplements are going to be inulin, psyllium husk, guar gum. Yeah.
Perfect. How often should people retest?
Yeah, so I would say about 3 months is a good time. And it depends what's in there. If you have like a bacteria, dysbiotic bacteria, you want to go ahead and do a course of treatment and then just give the microbiome 2 weeks to reequilibrate. You can just order a small portion of the test to retest that part. So we offer smaller reordering portions if you want to retest something. And if you want to retest the whole thing, you're available to do that as well.
Amazing. And we have time for about 2 more questions. Do you supplement with beta glucuronidase?
Not necessarily. You could do D-glucuric acid, DIM, cruciferous vegetables.
Love cruciferous vegetables. How does fasting, liquid, dry, or other affect the results of this test?
Yeah, fasting does influence the microbiome, and there's some evidence that it's actually going to be beneficial. I haven't, full disclosure, I've not seen a test on a patient that's doing like a 5-day fast or like maybe one of those prolonged fasts or anything like that. I mean, I haven't seen that. I do think it would, what the research shows is that it would potentially reequilibrate to normal biotic. That's what I'd expect to see, but I haven't seen that. Yeah.
Dr. Malkowski, thank you so much for joining us today. That's all we have time for questions for today. Do you have any final thoughts to get out to the folks who are still with us here?
Oh, no, thank you so much. I know everyone's time is valuable, so I really appreciate it. And please reach out to us at Doctor's Data for any additional info.
Yes, absolutely. That was incredible. Thank you so much again for joining us today. And thank you for the whole Doctor's Data team, Angie and everybody over there. Shout out to Jonathan and of course to you, Dr. Malkowski. We will see you all soon. And from here, we're going to transition into a quick demonstration of Rupa Health and show you exactly how to order these tests from Doctor's Data through our platform. And so with that, I'm going to share the screen and you're welcome to stick around, or you can jump off, Dr. Malkowski. But we want to give another quick shout out to the team over at Doctor's Data. And so with that, y'all, I'm going to transition. And for those of you who may not know who I am and what I do, my name is Adrian Martinez, and I'm the head of practitioner partnerships here at Rupa Health. Rupa Health is a functional medicine lab platform. We have the mission to bring functional root cause medicine to every person on the planet who needs it. Right now, there are a lot of barriers. One of the biggest barriers is time, right? Traditionally, you would have to set up accounts with every single individual lab that you want to order tests from. Doctor's Data, Genova, you name it, anyone out there, you have to have a specific account with that lab before placing an order. What we do here at Rupa Health is we bring them all into one place. And so no longer do you have to have separate accounts. You have a one-stop shop to order all your testing without going to each individual lab to order those tests. To show you exactly how simple it is, I'm going to press this blue button up here that says start an order. And all I need is my patient's first name, last name, and email address. From there, it'll bring me directly into my order screen where I can do things like setting up custom bundles, which are sets of tests from a combination of any lab that we work with. And I can even set up a favorites list. So if I have individual tests that I commonly order, I can just put a little heart next to it. And so when I'm ready to order that GI 360 from Doctor's Data, but maybe I also want to order a HUMAP from Doctor's Data. And let's say that I also want to potentially add on a CBC from LabCorp because I want to test the blood. I can do that all in one place. And if that's it, I just click send a patient. and that's it. Saving you time. That's exactly what we're designed to do, is optimize your business to free up the time and the essential manual work that goes into this testing. We will offload that off your shoulders onto ours. As soon as you press send on that order, we will also take care of the patient experience. We'll drop ship the kits to your patients. We can handle support, any specimen issues that come up, even coordinating phlebotomy. So if you're ordering a test through LabCorp, we'll send all the information and instructions directly to your patients on how to take the test. They're not going to come to you for support. We will handle all the support, again, freeing up your time. How does our pricing work? Big question, seeing it coming through the chat. We offer wholesale practitioner prices. So those same prices that you would get as a practitioner having an account directly with the lab, that's the same price that you're getting here at Rupa Health. The way that we generate our revenue is there's a flat 7% processing and ordering fee on each order, and that's paid for by whoever pays for the tests. So you have the option of either, I see this question in the chat, you have the option of either paying for the tests yourself. So yes, you can bill on your own and bill the patient separately, or we can handle billing directly with the patients. And that way they'll pay for the test, they'll pay that 7% processing and ordering fee, and you will never pay a dime for Rupa. There's no cost, right? If the patients are paying for everything, then you'll never pay a dime for Rupa. It's completely free to sign up for. There's no cost, there's no subscription fee, there's no contract, there's no minimum spend. You can go to rupahealth.com right now and sign up in a matter of seconds, completely for free. Now, once you press send on that order, as I mentioned, we will take care of everything in between, but a couple of things to highlight. While Rupa doesn't accept insurance directly through our platform, we can give you the opportunity to add ICD-10 codes into your order. My favorite one being sibling rivalry. You can add that right on there, and we will automatically create a super bill for your patients so they can submit that to their insurance for potential reimbursement. Now, one thing, if you're a functional medicine practitioner, you know about these tests. They are difficult to get covered by insurance. And so while we don't accept insurance on our platform directly, we can put your patient in the best possible position to get that potential reimbursement that can be so important. Beyond that, let's talk a little bit about cost. Again, if you've ever done these tests, you know that they can be expensive. And so that is another potential barrier that Rupa helps cover. So not only are we providing that lower practitioner price to your patients, we can also accept HSA, we can accept FSA, and we can even set up a 3-month interest-free payment plan with your patients to help pay for the cost of these tests. That payment plan is huge. The goal there is to help lower the barrier to get access to these very important tests for you and your patients. It's as simple as that. We'll send over instructions, FAQs, help coordinate those tests. We'll handle any specimen issues and, of course, any support that comes alongside of it. And that is the Rupa experience end to end. From there, you're tracking everything in one place. Again, traditionally, you're going to have to go to each individual lab portal, not only to set up your accounts, but to track the progress and status of each of your orders. Within Rupa, you can see everything in one place. So I can see when that sample arrived at the lab, when I can expect those results to come in, and then I can download the results straight away. I can send them to my patients. And as Dr. Malkowski mentioned earlier in the presentation, having that clinical support is important. And by working with Rupa, you're not losing out on any of that. You still have the ability to schedule time with a clinician from the lab that you're ordering from. So you'll still have the ability to schedule time directly with a doctor's data clinician. We also have some cool tools. Not only can you send the results to the patient, but you can also create a result summary. Depending on the lab, if they're sending us a specific file type, our system can actually read all the biomarkers. You can create visualizations, as well as you can add next steps. You can add tasks for the patient. And what this is going to do is create a patient-facing, easy-to-read next step PDF. You can add your logo to it, your branding to it, and it's just another tool that you can use to create a simple, easy-to-read PDF for your patients to see, hey, these are your tests, these are the results and the outliers. What can I do to fix? What can I do for my next steps? Pretty cool. And additionally, beyond just being a place where you can come and order all your tests, as you all see here, we do a lot of education. This is Rupa University, right? And so you can order all your tests, but you can also come and learn about the tests too. And so you can see some upcoming boot camps that we do, which are 6-week deep dives into lab testing. You can see the live classes that we've done. Of course, the one that we just finished with Dr. Malkowski. We have one coming up with Dr. Jim Lavelle. And we actually, funny enough, have one coming up at the end of next month on Akkermansia. So stay tuned for that. That is going to be a great one at the end of the month. So if you are interested in learning a little bit about that, We do have some cool supplementation webinars coming up as well. We even have some tools unique to Rupa Health, like compare tests. We have over 30 labs and over 3,000 different tests on our platform. No one person in the world is an expert on all of them. And so understanding that, you can come with a lot of questions and say, hey, what's going on with all these different tests? We have the ability to compare them. And so from there, you can hop on and you can see, hey, what are the tests on the platform? What are they testing for? What are the costs? What are the sample reports look like? What are the turnaround times? And then down below, you can get an idea as to all the different biomarkers that it's testing for, something that's unique to Rupa Health specifically. And we even have a podcast, we have a magazine, we have a ton of different information available for you here. And so again, beyond just somewhere where you're going to come and order all your tests, we want to provide you with the ability to continue to learn about the test, because functional medicine is an ever evolving place, right? And so we want to be a one-stop shop for you. With that, y'all, I'm going to see if there's anything in the chat, but what I do want to show you as well is we have some cool tools like food plans. Food plans is the ability for you to create a meal plan for your patients. It's AI. It happens in just a matter of seconds, but I can hop in here and I can create a meal plan, which is pretty cool. So let's say I want 3 meals per day, 2 snacks, hop in, diet plan, anti-inflammatory, preferences, no fish. Let's go with this other one, diet plan, high protein and low fat. Dietary restrictions, gluten-free. And then we can even track the calories and the nutrients as well. And then I just click generate food plan and you'll be able to see everything that hops in. You can see how quick that this creates a meal plan, a 7-day meal plan, which is pretty incredible. Now, a couple of things that are important about Rupa Health is right now we only operate in the United States. So we can only help patients in the US. If you are a practitioner outside of the US, you do have the ability to create a Rupa account, but we can only service patients in the US currently. Right now, we do not operate in New York, New Jersey, or Rhode Island, but we are working on a solution for that. And if you are a practitioner whose licenses may limit your ability to order certain testing, we have a program called Physician Services where you can sign up and you can get partnered with a licensed physician who can order those tests on behalf of your patients. So keep that in mind. Don't let maybe a specific regulation. If you're a naturopathic doctor in Florida, you're an unlicensed practitioner, let us know. We can, do our best to help. See actual recipes. Yeah, good question. That is version 2. We're working on the recipe component to it. There's a lot that we're going to build out with this, but, you can hop in, you can edit it. If I want to ask, please add a shopping list. I can update that food plan and it will do that. So it'll do the same thing and then add a shopping list down below, but recipes, not quite yet. We also have Lab Shops. Lab Shops is an incredible tool because it allows you to create a patient-facing or client-facing e-commerce. So you can create your own lab shop. You can say what you're offering. You can embed videos, again, add your own branding and marketing. And then from there, you'll be able to have on your website embedded saying, hey, this is my product offering. These are the labs that I offer, and your patients are going to be able to order these tests directly through here. So that's Rupa Health, y'all. I'm going to add my contact information, and then I'm going to hop into the chat because I saw that there was a few that came in. This is my contact information. Again, my name is Adrian. My email is just adrian@Rupa Health. Very simple. There's my phone number. Feel free to call me. So if any of you have any questions, please reach out directly to me. I'm more than happy to hop on a call, Zoom, walk you through everything, answer questions that you have. But let me go ahead and hop in to the chat. Insurance pays for some tests, but again, we don't have any insight into that, Carla. So what we do is, again, just through those ICD-10 codes, create that super bill, and that's the best that we can do to put them in a position to get that potential reimbursement. For lab companies that test in EU, no, unfortunately not, Colette. You'd want to work directly with the labs in that case until we have the ability to work in Europe, which is funny. I actually had a business proposal to the company not long ago for Europa, the European branch of Rupa Health. So keep that in mind. It was more of like a kind of a joke because I love Europe, but jumping down, if we want to talk to a doctor from doctor's data about the test results. Yeah, so good question, Darcy. We actually set up the accounts directly with the labs. And so while you're taking the order, or rather while you're placing the order with Rupa Health is not replacing doctors' data. We're actually creating an account with doctors' data, and through that, basically providing you with a more efficient solution to order your testing. However, you're still going to have an account directly with doctors' data. That being said, when you're scheduling that clinical consultation, as it's called, with the practitioner from doctor's data, you would need to do that through Rupa Health. And the reason being is there's specific identifiers on that order through Rupa Health, so they can find that order on their back end. But yeah, you'll still have access to everything with directly doctor's data, the clinical consultations, and everything that Dr. Malkowski mentioned. Jennifer, if you want to reach out to me, I'm more than happy to talk about it. Rhode Island is something that we're absolutely working on. It's actually kind of a very big initiative for us to be able to open up not all the tests. Eventually, that will be all the tests, but we have our more popular tests like doctors' data and among others that we want to bring in there. Can you put your labs for panels like Quest cash discount? Sorry, Misty, I'm just reading your question right now. Can you put your labs for panels like Quest cash discount? Not sure if I fully understand the Quest question, but I can dig a little bit more into that. So we actually have Quest and LabCore on our platform. Quest is on a brief hold right now where we're kind of figuring out some logistics behind it. But you can create the panels directly on our platform as well. In terms of like any discounting or anything like that, not positive on what that would look like on your end. So I'd love to learn a little bit more about how you're doing it. And then, we can talk about how it'll work on our end. I'd love to have a call back. Yeah, Kathy, great to see you. Go ahead and reach out directly to me. Labs for pellet therapy. Good question. Pellet therapy, in my understanding, is more of a physical product as opposed to a lab test is what we more so focus on, Misty. So we don't have, I believe, any pellets on our system, but I think pellet therapy is so interesting. But feel free to reach out to me if you have any questions. I'm more than happy. What's really cool about Rupa is if there are any questions about tests, and I should have probably gone through this, we have the lab test catalog and you can search for anything. So you can hop into the lab test catalog as I'm doing here. And if I want to search, I'll just search for pellets. Let's find out together, everyone. Doesn't look like anything's popping up. Platelets. But you can hop in here. I can search for, and browse by lab company. I can search by category. I can even search by biomarker. So if I want to just search for like zonulin, for example, put it in, and it'll bring up all the tests that have zonulin within it. If a client pays in 3 months, are they paying Rupa or me? Wendy, great question. So that would be through Rupa Health. If you were to be the one who handles billing, you would pay everything up front. And then it would be on you if you want to set up any payment installment with the patient. Rupa, if the only way that those alternative payment solutions are available, again, HSA, FSA, as well as payment plan, if Rupa is the one that manages billing directly with the patient. So that's when that's available. Dr. Potter, thank you for that. Angie, great to see you. Thank you so much for joining us. Angie's on the doctor's data team. I think she just wrote that privately to me, but love the team over at doctor's data. Perfect. Dr. Potter, I appreciate the insight. Again, y'all, my name is Adrian. I'm going to share just again my contact information. If any of you will be at AIC in Florida this next week, I will be there as well. Be sure to stop by our booth. You can't miss me. I'm going to be wearing how do I say, a pretty recognizable outfit. So hopefully I'll see some of you out in Orlando next week. How does it work if you already have an account with some of these labs? Yeah, great question, Lynn. So we're actually going to be setting up a separate account with the labs. So nothing will be impacted on your direct account, but we would create a separate account with the lab. That would basically be a Rupa account, independent of the individual account that you have with the lab. Yeah, great question. And there's reasons for that. We don't want our orders to be making an impact on any of your individual orders. Additionally, there's a lot of times where potentially maybe ordering directly from a lab is a better experience for you or your patients, right? I'll give an example of Genova, right? No secret that Genova accepts insurance when you work directly with them. That's not something that we can offer. And so if by offering your patient the opportunity to order Genova and use their insurance is going to be a better opportunity, by all means do it. But you can order all your other tests through Rupa Health. We are truly meant to be a supplement and a product that improves your business, not entirely uproot your existing operations. And so use Rupa how it makes the most sense within your business. Again, it's completely free. Sign up, give it a shot. And if you love it, stick with it. If for whatever reason you don't like it, that's that, right? But please come see us again for these webinars. They're my favorite. I love seeing all the faces. Please reach out if you have any questions. And I look forward to seeing you again soon.